on board, what are the most significant routes of transmission of COVID?
Well, I mean, the SARS-CoV-2 is a respiratory virus that's transmitted through direct contact and through respiratory transmission. Most transmission is thought to occur at a distance of less than 6 feet or 2 meters, which is why we have the specific physical distancing requirements and so forth, although there is some mounting evidence to suggest that airborne transmission is possible and in some cases likely. The cruise industry has taken steps to modify ventilation systems on a number of their ships to minimize the possibility of airborne transmission of SARS-CoV-2 virus causes COVID-19. Specifics include things like enhanced filtration and updating the cleaning and disinfection protocols, just to name a few.
And I've also seen where UV lights are added to some of those ventilation systems.
Sure.
To also kill the virus.
Sure.
We read in the framework about the necessity of port agreements for the cruise lines to have. Can you describe what these port agreements entail?
Sure. There are a number of port agreements that are required under the CSO framework. And the idea behind those is, of course, not only to protect the people that are on board the ships, but also to protect the people who support the ships as well. And so there are specific requirements in terms of cleaning and disinfection protocols. There's a development of contractual agreements for medical evacuation and medical care at various US ports. And that's a result of some of the problems that were identified when outbreaks occurred early in the pandemic on cruise ships, and getting access to medical care ashore was quite difficult, including evacuations from the ship, if you recall. Also, there's a requirement for developing housing contractual agreements to accommodate the isolation and quarantine needs that might occur should there be an outbreak on board a cruise ship. The requirements are all in response to the SARS-CoV-2 outbreaks aboard cruise ships and the strain that it placed on the US port community. So there's an attempt to reduce the impact of an outbreak on the receiving community, the supporting medical staff, and so on. So that's what, excuse me, that's why the port agreements are required.